Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callander.
Becoming one of the commonest causes of death outside of gun shooting and violence in the United States and actually the world. And at one point, if you died from suicide, they wouldn't put it in the obituary because they didn't want anybody to use that as a reason to commit suicide. But as we become more enlightened, and as the stigma of suicide is becoming less, we talked about the fact that we're seeing suicide in the obituary more now than ever before. They wouldn't put that in the obituary, but now they are, with the hope that if you were thinking about suicide, you would get some help. And you have all these telephone numbers and everything else that's available to you if you're thinking about suicide. But it's an epidemic that has worsened with the pandemic, and particularly is involving the younger people more so than ever. And so that was one of the things they talked about. They also talked about something that we've talked about ad nauseum, and that is the key habits that go along with long life. And none of them are new to us. Not smoking, being physically active, managing stress, eating a healthy diet, having good sleep hygiene, avoiding binge drinking, and not being addicted to opioids, and finally having positive social relationships. We talk about that almost every session, but anyway, it's interesting to see that featured in the Washington Post, 8 Healthy Habits. Yeah. And there was also an article for you teachers that talked about the fact that half of the children in the world have been abused, and that within a year of that abuse, they should seek mental health or be given mental health because this then results in mental health issues that are there for the rest of their lives. Uh, they don't talk about preventing the abuse. They just talk about the interventions that are necessary once you have been abused. And in our schools in the district, do we have programs for those kids who suffer from abuse? Many of your teachers, what is your experience?
I know they have school psychologists that can help individual students who are identified with abusive.
They can, do they?
Yes.
So every child who is associated with, that they identify with physical abuse, they have psychological support.
I'm saying that they have too many children and not enough workers. They have one psychologist for a school, even if it's 500. Even in high schools, they have it. But they have a lot more children that are abused. They have social workers and everything, and they're on. It's just too many caseloads. Not only in DC, but in PG and all that. So I don't see how they can support it.
The grown.
Any other?
Also, Dr. Callander, all the teachers in DCPS at least were given training on being able to identify abuse when they see it. Because in the past, like when we first started teaching, we would see things but wouldn't recognize them as signs of abuse. But when children act out sometimes or are hiding injury, or you can see it on their face, or we have to report those things now. It is mandatory. You have to keep a record of everything that you see, and one thing you don't do is contact the parent. You go to the system and Child Protective Services to document all those signs of abuse now.
The other thing is the counselors try to help when a student dies, regardless of the way, gunshot, suicide, or it doesn't matter what kind of death the student had, but sometimes they close the school down, for a day or something, but the psychologists are there. And that's when they bring a group in. They bring the psychologist, who is the professional, and then they have teachers, social workers, and they all gather and they go around to classes, and they have meetings and so forth. So yeah, they do have psychologists trying to help out.
I have heard it. I have never seen it in 47 years for it to happen. I know they said that's going to happen, but I've never seen it. Have you seen it, John or John?
I've seen it where someone in the school dies, and there's some kind of a memoriam or some kind of help from the psychologist, a meeting, or assembly, or something like that. I've seen that.
But I'm saying I've never seen a group of people come into the building.
It's the internal, mostly the social workers at the building, and the resident psychologists and nurses and anybody else come together to try to counsel the students who've lost one of their own.
One of the areas that may not show is sexual abuse, and that's an area that is tough to address, because apparently the most common source of the abuse is the relatives. Is that handled any better now than it used to be? Because in the past it was ignored.
Well, Dr. Callander, my son is a fourth grade elementary teacher, and he's come across students that have done drawings where obviously there was sexual abuse done to them. And so that gets turned over. And in regards to the parents also in the family, yeah, a lot of violence is coming from the parents. And also a lot of these people are coming into the country through other countries, and along their path, they're getting abused. So, I mean, my son works in predominantly Hispanic, Black elementary school. And there's through the Hispanics, a lot of abuse.
Does he think that it is handled well? What is his thoughts about? Do you know? Well,
I guess right away you contact the administrator above him, and through counseling they start getting involved with it. So yes, it doesn't get swept any underneath any rugs.
That's good to hear.
Mm-hmm.
Because there's much evidence that later on in life they come up with a lot of disease entities that occur as a consequence of the abuse that is not handled early enough. Okay, I guess we can go to the first article. Yeah, this shows it reached an all-time high in 2022. Almost 50,000 people took their own lives last year. Uh, Highest number ever, which is frightening. And it hurts the most when it's the children, and but it hurts anyway. It doesn't matter with adults or children, but I guess parents really suffer so much when it's the children. But you suffer whenever anybody dies like that. See many people fighting for life, and then you see all these people killing themselves. Have you seen this in your lives, or is this just something that you see in when you read about? Is
I
it
I had
any
a
of you
student,
personally?
yeah, Dr. Callander, I had a student, uh, one of my junior high school students. I think I talked about it on a session before, who he came back while I was teaching. He was one of my outstanding band members, first trumpet player, and came back several years after he graduated from from high school. He had a girlfriend that was pregnant, and she left him. And he sat through band rehearsal and waited till everybody left and started talking to me about, the situation, how upset he was. 2 days later, he hung himself.
Mm.
I wish I had, you have a feeling of guilt. I wish I had been able to identify that and said something that might have changed his mind to take his life, because he was brilliant. He was handsome young man, gifted. But this is a situation where, you know where he was about to be a father, and the girlfriend broke up with him. I mean, it was too much for him to handle.
Any other people associated with suicides?
Dr. Callander, there have been attempts to suicide in my family. And thank the Lord, they didn't go through with it. And they were able to recover, like for instance, some overdose on some pills or something, your stomach can get pumped out.
Yeah. Wow. Yeah, I've seen these descriptions of what happens with these children. Depression is often at the root of a lot of it. And when people who are depressed take the medication, often they seem to be controlled, but sometimes when they stop taking the medications, that's when they commit suicide.
Well, Dr. Callander, years ago, my brother closest to me passed away, and I hope it wasn't suicide. I hope it was, accidental drug overdose. But there was a lot of things going wrong in his life that he just tried to medicate himself.
Yeah. Yeah. So the emptiness and sorrow that goes along with is often unbearable for many.
Mm-hmm.
And Dr. Callander, you've said that, I didn't see it in this article, but during the COVID period, there was a slight increase in suicide.
There was a tremendous increase in Black teen suicide. Yes. And so this has contributed to the suicide epidemic as well. Loneliness and the isolation that goes along with the pandemic. So socialization and interaction is one of the best things you can do, and have people talk about whatever's going on with them. And then you have all the suicide lines now that open 24/7.
Dr. Callander, which reminds me, my brother was bringing to me about having empathy. A lot of times I even notice in school, even with family, even with the young people, they're talking about a breakup or something that I think is insignificant, but to them it's very real. Like I had a young lady in the classroom and the kids were all empathetic with her, and she had to go outside the classroom and cry because she just broke up with her boyfriend. To me, in my mind, I'm saying, what? Get back in this classroom. Break it up. But to her, that's real. And, reading the articles, when people break up, to you, it's no big deal, but to them it is. And no matter what their plight, if you think it's insignificant, all they need is someone to listen to them, be empathetic with them. But that's one of the hardest things for us human beings, especially if we have never felt that emotion or rejection or whatever they're going through. Like my mother got up this morning and started fussing at me, and we're going, yeah, right. But to them, that is an emotional crisis. So if we could just give people their listening ears, we may not feel it, but they're feeling it. And when it comes to depression, they're getting depressed over things that we may never even experience or even think about, that we've been through a lot of times. But it's being empathetic with that person. And that's one of the hardest things to learn how to do without acting fake about it.
One of the changes in our society is that there's a book by Ayn Rand that's kind of the hallmark of the right-wing society, and it talks about the bootstrap theory: pull yourself up by your bootstraps, be independent, be self-sufficient. But anyway, it denigrates qualities such as compassion, being nice, considerate, kind. And so those things are out of vogue. We're not in a society where it's encouraged to be compassionate, kind, considerate to other people. They're called snowflakes if you're like that. And it's kind of unfortunate, but that's the direction that this country is going.
Well, thank you for your comments. And it's in many ways, it's all about love and showing care and compassion for one another. Because just as Carol stated, it's not what we feel, but it's what they feel. And at least we can give a listening ear, whether we empathize or not. We can at least listen and try to help them as they go through the agony. Okay, any other comments? If not, this is an interesting article we read about all the time.
My last comment would be, I guarantee most of these suicides, someone's been talking on Facebook or some other social media, and their friends aren't recognizing that he's suicidal right now. Because chances are they're trying to like verbalize it first. And the education of teaching people how to recognize signs is paramount.
Thank you. This is an article about people who are what they call super ages, who are old, meaning over 65. And the super ages they talk about over 80. But this study they're talking about over 79. So and they're monitoring them to see what how they have managed to be over 79 and still have the same mentality and the cognition. And they also did MRIs to identify the gray matter and see if there was a decrease in the gray matter or increase. And they then, after looking at this, they tried to decide what made these people over 79 so different from the other group. And and they identified some of the things that we mentioned at the beginning of the program. And they talk about physical fitness being important. And we also, over the last couple of weeks, talked about how being physically fit helps with depression and anxiety, and how exercise makes a difference. Also, they didn't have genetic predispositions to mental illness, and they talk about the APOE 64 allele, which is thought to be associated with Alzheimer's. Then they found that they didn't have that, but some of them did and some didn't. So that wasn't. And then, of course, mental function. They still had their memories, which, as many of the people on this program who are over 79 have. So that physical and mental function are closely intertwined, and the more active we are physically and mentally, the more likely we are to fit into this super ager group. Remember, we talked before that they expect when you get to be 80 that many people expect you're going to drop out mentally and physically. Point of fact, these people do not. They continue to be involved with athletics and social organizations as well.
I have a comment. Along with my father, who was a senior athlete, around the country, and he was almost 4 days from being 102 years old. But he was in a circle where they had different sports, basketball, tennis, and different things that the super ages were playing. And I remember one guy who was a tennis player, and he was still playing tennis at 100 years old. And so I wanted Dr. Atto to know that he was still, he was still playing tennis good. He was still winning games. And so,
Oh my God.
yeah. And Mary Ellen, if you and I can find that CD.
Yeah.
Oh, I got it.
You got it.
Mm-hmm.
We'll get it to Dr. Atto.
Oh my God. Okay. That's fantastic. Okay.
I'll bring it with me.
Okay.
Okay. Now, this is something that John Buchanan has been warning us about, not about a new strain, but the fact that COVID is becoming more active. Here in DC, of course, there's a new strain in Michigan, but what is clear is that more and more cases of COVID are manifesting themselves and are requiring hospitalization. Not as much as it used to be, but still more than had been reached. So it's important that you be up to date with your vaccinations, because even those people who are vaccinated get COVID. And of course, we now have medications that are helpful, but all of these things have side effects. And so, whether this variant that's reported in Michigan is going to be a cause for things to happen all over again remains to be seen. So time will tell. But one thing is clear is that the COVID is back again. Not as violent as it was before, but it's back again. Had a number of people. One of my doctors a couple of doctors who come down with COVID over in the last week or so. But these are people who have been vaccinated, so they haven't required hospitalization. But those people who are not vaccinated are likely to require hospitalization and may even die. I think it is important for us to recognize that as we approach September and October, that the three vaccines that we need to have, the COVID, the flu, and the RSV vaccine. I think there are some people in this group who were part of the RSV study, but the RSV vaccine is now available for people over 3 and over 65. And so when you get your vaccines, you need to get 3 of them. The COVID, the RSV, and the flu shot. Any,
I have a question.
yes,
Can you get all 3 at the same time?
yes.
Okay, well, that's my plan.
Is the new COVID vaccine out now? The booster?
It's probably not coming out until September. So if you have not been vaccinated in the last 6 months, I think within 6 months you're protected. Beyond 6 months, we're not sure how long that protection will last. It is expected that the COVID vaccine that you get this September will last for a year rather than 6 months. Now, the only group that we're not clear on is the immunosuppressed group, patients who've been transplanted or cancer therapy or other therapies. They still do not have the immunity that people who are not immunosuppressed have. So it's important for that group to keep up your vaccinations.
Dr. Callander, this is Sylvia. For getting the vaccination in September, have they developed, is it a new Pfizer, Moderna, or did they say?
Say again, I didn't understand your question.
I said, is the new vaccine Pfizer, Moderna, or which one is it?
I don't know. I don't know which one. So I don't know. I guess when it comes out in September, they'll be able to tell us. But they haven't told us that. It sounds like Pfizer. What does it say there? But it say it could be, but it's not authorized yet. So.
Yeah, Pfizer
So
should be ready by the end of August.
Yeah, it should be. So, but they will announce it. They'll announce it.
Okay.
But
You.
remember, September is only 10 days away.
I know.
Yeah.
I know.
So.
And I'm going to try to get my mom She has a medical appointment in September to see if she can get all three, and she's 92.
Yeah, right. The RSV is the one that we didn't have before. So this is brand new. And this is something that we need to take advantage of.
I know that CVS is offering the flu shot and the COVID shot for free. I haven't heard anything about the RSV shot yet.
Right. The RSV is available though.
That might be free also. I don't know.
But don't we want to wait for the new updated version in
The
September?
RSV just came out. They never see the difference between the other vaccines is they are already out. RSV has just been approved by CDC in August.
Yeah,
late July.
if John had mentioned that CVS was offering the COVID, I'm saying you don't want to take it at CVS now until the new version comes out in September.
No, it depends upon whether you have updated. Because if that's why I made the point about how long ago did you get your vaccine?
Mm-hmm.
If you have a COVID vaccine in the last 6 months, then you're straight. But if you haven't, then that's another story because you're over 6 months. So look at the date of your last vaccination. And
yeah,
if
mine
it's
is scheduled for September because it was last April. Or
oh,
April
so
this year.
I
Yeah.
mean this April.
Yes.
Yeah. So you're straight. Yeah. So you wait for September. You take the vaccine that will give you 12 months coverage.
Oh, okay. Thank you.
Yeah, I'd wait for that since you already you May, June, July, August, September. So you're good. Yeah.
It says you can get the shots for free if you have insurance.
That sounds like a trick, but I don't know.
Well, actually, as you know, that was covered by the president, so that whether you have Medicare or Medicaid, CVS is giving it to you for free.
I think I saw one line where they didn't advise you getting all three at one time. Now I know like the shingle shot, and I'm glad I was advised not to get that at the same time as I got the COVID shot because the shingle shot, the side effects killed me. And I'm really hesitant about getting the second one. But really and truly, can you space them out or something like that?
Well, for shingles, you're right. I think your observation is correct. The shingles is different from the three that we talked about, because we talked about the three of COVID, RSV, and flu, which is different from the shingles, which is different. So yeah, you can space them out as you like, though. No, it isn't mandatory that you get all three at the same time. You can take
no matter what, you got to get stuck 3 times, right? They can't put it all in one vial and just give it to you once.
No. Sorry. I think we'll get to that point, but we haven't gotten there yet. Now, remember, only 17% of Americans have gotten the 6 shots that go along with the booster. So that there's only 17% that have actually taken advantage of it. So many are not up to date with the COVID shots. And the RSV is brand new. So
Part of that 17%.
I'm sorry?
I said I'm part of that 17%.
Yeah, so am I. Then the
Someone sounds like they're outside. Can you mute your phone if you're outside? Because we're getting feedback. Getting some wind.
That's John.
Okay. So any other comments or questions about the fact that these boosters are available now? This article is an interesting article that suggests that you get the booster the same arm as your last COVID shot. Well, the data suggests that that's an issue. Have any of you changed arms, or you get it all of it in the same arm?
Mine's in the same.
I don't
Yeah.
remember.
Mine in the same arm. I have to do it because of the breast cancer stuff. I can only get it in my right arm.
Right.
It's within my left breast.
Good. Yeah. Good. Makes sense.
Beautiful. It's in the chair, no?
Well, I think it's a moot point, but it does make sense to get in the same arm if the studies suggest that it's the case. And the fact that it's a small study means it's really not that generalizable, but it's a study nonetheless.
That's something that I'm gonna have to think about, Dr. Callander.
I mean, which arm?
Yeah, because I think the pacemaker procedure was on my left side, and the stent procedure was definitely on my right side.
Can you get
Okay.
vaccinated in another area? Can you get vaccinated in a leg or anything, Dr. Callander?
What's the question?
I said, can you get vaccinated in an area other than the arm?
Yeah, you can, yes.
Okay.
It's just that the arm is easy to do and you don't have to undress. But yes, you can.
Yeah, I was thinking about John's question. He was talking about he had to think about whether to get the shot.
No, he doesn't have to think whether he gets shot, which arm he's gonna take the shot. That's what he's thinking of.
You can also get it in your butt.
Yeah, you can.
You have to pull your pants down.
Yeah, that's the difference. Yeah.
Yeah, you have to undress for that one.
Yeah.
At least half.
But the pacemaker and the stent really are in different locations because the stent is at the wrist, right?
Yeah, it goes from the wrist all the way up. Yeah.
Right. So the arm is not affected by that. Now, this is an interesting article about this guy who had a damage to his eye, corneal damage, and they used stem cells from his other eye to grow back his cornea. And it was very successful. It's interesting how stem cells and regenerative medicine are becoming more and more available. And this is a novel stem cell treatment, which they took his own limbal epithelial cells and grew them and then put them back in. And it's wonderful to see how science is advancing and how this made a difference with this gentleman. Of course, the fact is that stem cell transplants are the regenerative medicine of the future, while xenotransplants, which we talked about last week, are important. Still, stem cells also loom large in our future. So, stem cells regenerating organs and other tissues is something that is likely here to stay.
Mm.
It's amazing how these things the wonders of corneal transplant. We have one of our surgeons actually who has had a corneal transplant maybe about 20 years ago, and he's operating every day. Keratoconus is the commonest reason why you require a corneal transplant, but damages like this to the cornea can also be a reason for corneal transplantation.
So, Dr. Callander, it's my understanding, it might be limited, that they'll take his stem cells out and grow them outside the body and then replace them back in.
That's what he did in this case, yes.
So my concern, I don't know why I always look at the negative, but when you do that, it's got to be sterile. It's got to be ultra sterile because
Absolutely.
You're exposing those cells to the air and dust,
Well,
all kind of stuff could happen.
Well, it's not really. I mean, as you mentioned, it has to be done under sterile conditions, period. Very sterile conditions, so that it's not left actually to the air. It's actually done under situations where they actually have it under a special area that is designed for this.
Okay.
So it's not. So it is an absolute sterility, as you mentioned. Yes.
All the air is filtered and everything.
Yeah.
So you remember Dr. Hurd that talked to us? He had done corneal transplants before. My classmate from Notre Dame that spoke to us.
Oh yeah, that's right. And
But
actually, Bob,
he didn't use stem cells. He used actual donated corneas, I believe.
that's correct. Yeah, and they are preserved, and I think Bob Copeland, who was our corneal transplant surgeon, did about 40 to 50 a year for a while.
Wow.
And they're so successful. It's upwards of 90 to 95% successful.
Okay.
This is a statement that may be thought to be controversial, but the fact is, and the date is incorrect. I mean, when you write these papers, you should at least try to find out accurately. We did 40,000 kidney transplants last year.
Mm.
So this says 25,000, which is way off. But the point is that 17 people die every day because of the shortage of donors. And so the fact is that everybody can't be transplanted. So why not have an artificial kidney that can be implanted? And so, yes, this could be the future because most people on dialysis are not transplanted. And many of them are not even candidates for many reasons. And so the wisdom of having an implantable artificial kidney is a very great idea. And so this is something that is likely to come to pass within the next 5 to 10 years. And the difference between artificial kidney is that dialysis, as you will know, is 4 to 6 hours a day, 3 times a week for hemodialysis. Now, for peritoneal dialysis, is 8 hours every day, and that's different. And so the idea that you have a artificial kidney that works all the time is an improvement over hemodialysis. So inventing a membrane that is like the healthy kidney that works all the time is something that has not yet been developed, but is something that could work.
Dr. Callander, we talked about an implanted pancreas earlier, didn't we?
Yes, we did. Yes. So now we're talking about implanting a kidney, artificial kidney, which you wouldn't need immunosuppression or anything either. And hopefully you wouldn't need anticoagulation either. But it's going to take a lot of money. But anyway, it has not yet been done. It's just the thought that this is something that can be done in the future for people who can't be transplanted.
Dr. Callander, what kind of material would that artificial kidney be made of? How would they make it?
I don't know what kind of filter they're talking about. They didn't identify in this article what kind of filter they're talking about. And I think there's a reason for that, because they want to be the first to do it. But as you can see, they haven't started it yet. But it would have to be something that allows the good blood to the bad blood to be filtered out and the good blood to be returned.
So maybe some type of 3D printer.
Possible. Yeah, they mentioned that as a possible way of doing it. Yes, but since they haven't actually done it yet, it's conjecture. But it is something that is possible in the conceivable future, because the real issue is developing, as you mentioned, a filter that filters the poisons out and allows the good blood to stay in. So potassium and phosphorus and other things would need to be eliminated, because those are the things that accumulate and cause the symptoms of uremia, which is what in the long run causes the patients to decrease in their ability to function normally. Any other questions about that radical statement about the artificial kidney? One size doesn't fit all in blood pressure measurements, and that's very true, because if you have somebody who's very large, they need to have a large cup. Have somebody very thin, you need to have a relatively thinner cuff. And if you don't, the results will be inaccurate. But in particular, especially for the very large patient, they need to have a large or even extra large cuff. Otherwise, they will be you get results that would make you think they have hypertension, when in point of fact they don't. Often we don't talk about the fact that when you take blood pressures, that you need to have the patient to have been rested for about 15 to 20 minutes. And often people get their blood pressures taken when they haven't sat down and relaxed for a significant period. And that is one of the reasons why white coat hypertension is thought to be a problem, and why the best blood pressure is the one you may take at home when there's no pressure around you and while you're relaxed.
Doc, what about your diet? Suppose if you just had lunch with a lot of potato chips and French fries and soda and coffee, then you get your blood pressure taken. It's going to be higher.
Yes, it would be. Yeah, that's correct. It would be. And that's why it's better for you to take it at home when everything's stable.
With a diet like that, your blood sugar would be high too.
Dr. Callander, is there a difference in taking it with the wrist cup or a cup on your arm?
No, no, it should not be, because you use a different size cuff for each. There'll be a different size cuff for the wrist, different size cuff for the antebrachium. I think we kind of talked a little bit about this last week, because we talked about isometric exercises. That's interesting to talk about the wall squat. And remember, we had a feature of showing Dr. Ivy with the hand squeezer, and Tatum and Buchanan showing the ball that they squeeze. So for isometric exercises, but it is a little surprising that the most effective exercise in lowering blood pressure was isometric exercise. And the difference, of course, is that isometric exercises are exercises where the joint is not above and below, and not involved. And so you have one area. Now the wall squat is the most effective individual exercise. And it's an interesting one, in which not too many people do. And it only lasts 2 minutes. And but I don't know how many people who do the wall squat, but that was thought to be the most effective. But I think my wife does that, but it's when you see somebody do it, looks pretty easy. When you try to do it yourself, it isn't quite that easy. But in the final, yes.
This is Carol Tatum. I was doing planks, and I did more of them every time we talked about planks on the group session. And I just realized that it's been triggering my ulnar nerve entrapment. That's my funny bone. And so when I do planks, I just put pillows under my elbows, and it's fine.
Oh, okay. That works?
Yep.
Yeah. How often do you do the planks?
I like to do them daily, several times a day.
How long do you hold it for?
Well, I was showing off for Carol and John last night, and I did it for 2 minutes, 12 seconds.
Okay.
Interesting, the role of nitric oxide in lowering the blood pressure. Now, the reason that there's so much discussion about blood pressure is because hypertension and diabetes are 3 to 4 times as often as common in blacks and whites, and it is the leading cause. They're the leading cause of kidney disease and heart disease and strokes. So keeping a normal blood pressure is something that is critical to longevity. Now, this is an article a little scary in the sense that finding more cancers among younger people, although we recognize that it's commoner in older people, but we're now finding that people younger than 50 are having increased risk of cancer as well. And that's why many of the screenings are done at a younger age than we were doing before. And the thought is that the obesity, alcohol, smoking, and other environmental factors play a role in younger people having cancer. This is one of the things I guess that Darryl has talked about in terms of things that we're exposed to in our diets and in our environments that are making it more likely for younger people to have cancers. Interesting that the biggest increase was in Asian Pacific Islanders and Hispanics.
Dr. Callander, I have a message from Janet Stevenson. She says, I won't be able to log on today. I've mentioned my brother-in-law during past meetings, waiting for a kidney transplant patient, having problems with fluid buildup in his stomach. Recently, his heart stopped for 25 minutes. They brought him back to life. He is quite serious now. I've been sitting at the hospital with my sister. Please keep him in prayer.
Thank you.
What's his name? What's his name, John?
She didn't say what his name. Her brother-in-law. They're at the hospital now, and she's comforting her sister, who's married to her.
Yeah, okay. Thank you, and we'll keep him in prayer. Well, anyway, it's important to let your grandchildren and children be aware of the fact that the age range for screening is going down to 45. Of course, that doesn't mean that you can't get cancer under 45, because we have people who are in their 25s and 30 who get cancer. But formerly it was actually 50.
Dr. Callander, how common is breast cancer in males?
Very uncommon, but it does occur. And if you have any pain in the breast, or you feel your breast and there are any lumps, it's important to go to the doctor and have it mammogrammed and biopsied, because it is a cancer that is uncommon, but occurs in men as well.
I have a friend who had cancer, breast cancer, and was treated. He's doing well.
The early diagnosis is very important, so it can be treated before it spreads. It's killing so many of our women, it's frightening.
A couple comments. John, did your friend have to have a mastectomy?
No.
And the next comment.
If he had cancer, he didn't have a mastectomy? Because usually they do. Okay, because usually they do.
Yeah, I don't think so.
And the other question, Dr. Callander, we talk about a lot of different diseases in our group session. And the one that we talk about for family history is cancer. Is that correct?
Yes, well, there are many tests that demonstrate that it's a genetic, it's transmitted genetically, and that you have a genetic predisposition to cancer. So yes, it is a family history becomes very important in diagnosis of cancer. Whether it's breast cancer or ovarian cancer, cancer of any type, it's important to do genetic testing to see if other family members are likely to be exposed to the possibility of cancer, and therefore doing whatever is necessary, even sometimes prophylactic surgery, is necessary to prevent people from getting cancer later on in life. And so genetic tests can be helpful in finding out whether or not you are likely to develop cancer later on. If one family member has it, then genetic testing of that person can give you information that will allow you to know whether other family members need to be tested for that gene.
Yeah, and my point is that it sounds like it's more so with cancer than other diseases that we've talked about.
Yes, that's correct.
What about
And
diabetes?
diabetes is also a family disease. That also is just that cancer is has a higher mortality rate in the short run. Diabetes is a disease that is associated with a family as well, but it's just that cancer is associated with a higher mortality rate. But that's not saying that diabetes is not a deadly disease. It is if it's not. The difference is, at least with diabetes, you can manage it, and the complication rate, if diabetes is controlled, is effectively reduced. Whereas with cancer, the mortality rate is pretty high. And so often, if you have a genetic predisposition, it may be that you may have what is called a prophylactic removal of an organ, whether it be the ovaries or the breast or whatever, to prevent you from getting cancer. And this is something that we've just been talking about for the last 10 or 15 years. Getting the genetic test to find out whether or not you fit into the category that requires removal of the ovaries or other body parts that may turn into cancer later on. This is an article that talks about the role of vegetarian diets in decreasing the likelihood of cardiovascular disease. And it's not something that we're not aware of, but it's something that sort of remind people that diet means everything. And doing away with obesity and decreasing, eliminating smoking and other things, it's one of the better ways to control diseases, cardiovascular diseases, and especially diabetes. And then, of course, the hypercholesterolemias that are associated with heart attacks and kidney disease and strokes are optimally treated by vegetarian diets. So, vegetarian and vegan diets alike, excluding the processed foods, certainly, especially processed meats, are good ways of making you healthier. And this article points out the many ways in which vegetarian diets help people live longer lives, and especially lower blood pressure, normalizing blood sugars, and reducing the medication that you take, whatever you have. Hypertension, hyperglycemia, dyslipidemia is all part of the ways in which disease entities can be handled easier, especially cardiovascular diseases. This is the end of talking about the fact that all vegetarian diets aren't healthy, but most of them provide health benefits. Darryl, do you know much about tempura vegetables?
Yeah, it's a soy product.
Okay. Do you use them at all?
No, I don't. I try to avoid soy whenever possible.
I see. Okay. Okay. Any comments about this? Because I think that most of us recognize the value of vegetarian diets. And then this is an article that talks about plant-based or animal-based diets, which is better. And I think most of the data supports plant-based diets. Few would suggest animal-based diets, but there are healthy animal-based diets as well. But most of the data supports the plant-based diets as being the ideal. Any comment about this in terms of anybody who disagrees with the?
Well, I'm just curious, Doctor. I'm curious, and Daryl's probably really knowledgeable about it. Darryl, why do you avoid soy products?
Oh,
Okay, because it's a hybrid vegetable. Two types of hybrids. There's natural occurring hybrids. Like say an example of that is just about any apple that you buy. Apple genes combine with different variants, and that's a natural occurring hybrid vegetable. Fine, never a problem with apples. But there's a lot of man-made hybrid vegetables which are created well, by man, but for certain purposes to make them more resistant to different, attacks that vegetables could get, insect attacks,
Right.
greater yields. And so generally when man makes a hybrid, it doesn't digest as well by the body.
Okay, thank you.
Yeah, they single that out. I wondered why they singled that out as well.
If you do a search on man-made hybrids, you'll come up with things like cauliflower, broccoli, soy, let's see, almonds. But there's a long list of hybrids. If you're really sensitive to your gut digestion, you'll recognize what things and it's very slight difference, but it all counts. Hybrids, they don't digest as easily. One of the things that, like say for broccoli, there's broccoli flatulence. Some people counteract that by putting cheese on the broccoli. But if you eat a non-hybrid diet, you'll recognize how little flatulence your body has. Flatulence is one of the common reactions to eating hybridized foods.
Okay. I think this will be the last one because it's 10:25. We're going to leave at 10:30. This is interesting because in Tampa Bay, they found more bacteria in the beaches, which is a new bacterium in the warm seawater because it requires salt to live. This is something that's occurred in Florida that hasn't been reported elsewhere. And this vibriosis is associated with more infection and death than anything else. And so we're not in Florida, but and there isn't any evidence that this occurs here in the Maryland area. Now, those who eat raw undercooked oysters and shellfish can also get this, but are there many of you who like raw oysters or shellfish?
Yeah, I like sushi. I like oysters on the half shell. Not sashimi though. That's raw fish. I avoid that, but yeah, I like sushi.
Mm-hmm. So it just says it's more common in the raw.
Dr. Callander, this is Sylvia. My sister-in-law had some type of flesh-eating bacteria that got to her shins. I mean, it really took it down to the bare bone almost. It's been in treatment for a while. Her skin is healed, but it took a lot out of her and took a lot of treatments to get her a cure. And she lives in Florida.
Oh, interesting. Yeah.
Mm-hmm.
Did she find out how she got it, Sylvia?
No, I thought maybe she was in the water or something, but we didn't do too much conversation about it.
That's interesting. Yeah. Thanks for sharing.
Yeah.
There's one more short one.
Huh?
There's one more short article.
Okay. All right. Yes, this is something that
known caller.
That actually John Buchanan has talked about before, and how that sunscreens are important in terms of protecting us from ultraviolet rays. And the type you use varies, and with extreme heat, the type of sunscreen you may use may be different. Now, as we're having extreme heat in the middle states, I was noticing that almost all the middle states had temperatures of 100 degrees or above. And so when you're out in that kind of heat, it's important to have sunscreen on. And of course, it's important to wear sunglasses because ultraviolet rays are damaging. Now, John McKenna, you have any more comments about sunscreens?
Well, yeah, there's a couple of issues. One is that there are a couple of environmentally friendly sunscreens. When Black people put them on, they look like ghosts. You know, it's like a white coating over your black skin or your brown skin, which, you know, really looks dumb, but it protects the coral. The other issue is that if you're out on the water, like fishermen or divers, even though divers might have a wetsuit on, when you take that wetsuit off, you're exposed to direct sun plus reflected sun off the surface of the water. So you definitely need sunscreen to keep you from getting cancer, sunburn. You know, sunburns can turn into skin cancer. But if you use certain sunscreens, they have chemicals in them that actually kill the coral. So try to look for environmentally friendly sunscreen.
How do you recognize them?
It should say on the container, really. And I'm not sure the name of the chemical, but it's something like oxybenzene, something like that, which is, you know, common to almost all of the, you know, sunscreens prior to maybe 5 or 6 years ago. Once they figured out that that chemical kills coral, and, you know, coral is the foundation of our fishing industry. You know, the little fish eat the coral, and medium-sized fish eat the little fish, and big fish eat the medium-sized fish. And then we eat the medium-sized and big fish, you know. So without the coral, we won't have any more fish. So something to be aware of.
Okay. Thank you very much for sharing that with us. So that ends it for today.